Gail Boudreaux is a highly successful business leader and a champion athlete. Currently, she's the president and chief executive of Anthem, one of the nation's leading health benefits companies. Anthem covers more than 42 million people with its insurance plans. During Gail's career, she has held executive positions at Aetna, Blue Cross and Blue Shield of Illinois, Healthcare Services Corporation, and United Healthcare. She also founded and led her own healthcare consulting company. Recognizing Gail's accomplishments, both Forbes and Fortune have named her among America's most powerful women. Modern Healthcare lists her among the most influential leaders in healthcare. As a basketball fan myself, I'm in awe of her success on the basketball court as well in the executive suite. Gail led Dartmouth University to 3 Ivy League women's basketball championships, which is quite a remarkable accomplishment. She holds several school records, including an all-time leading scorer and a rebounder, and most points scored in a single game. She also was an All-American shot putter. Gail knows the value of teamwork. She's an authority on how the insurance industry works and is passionate about helping people gain access to affordable coverage. Please join me in welcoming Gail Boudreaux. Gail, welcome very much to our summit. Thank you so much for participating.
Thank you very much. It's great to be with you and a pleasure to be part of this panel. Exciting to talk about some of the changes going on in digital health in particular and all the acceleration that we've seen. So looking forward to our conversation.
Yeah, well, thank you very much. We collaborated. We've been having several conversations over the past several years, speaking about the ever-changing landscape in healthcare. But I remember when we met last, it was approximately a year and a half ago. None of us could have ever imagined that today our healthcare landscape is going to change so dramatically because of the worldwide pandemic. And all of us are seeing a substantial increase in the telehealth use among our patients or your members, with numbers reportedly up to 300%. How has your enterprise adapted to growing need and demand for telehealth services?
Yeah, I think that's actually a great question. And I recall our first meeting almost a year ago, a little year and a half ago, where we talked about the increase in telehealth and telemedicine. And fortuitously, I think you said that you see a significant amount of outpatient care heading to telemedicine. And I know that's been part of a partnership that we've also had with the Cleveland Clinic. But as I think about where we're going, we've been preparing and planning for this. We haven't had the utilization we've seen as part of the surge through COVID-19, but this has been a long-standing investment in digital health, digital tools, capabilities. And as I was thinking about how we got prepared and how to quickly mobilize telehealth, back for Anthem back in 2013, we were one of the first payers to actually incent and pay for virtual care visits in our provider care network. As we moved along with that, our goal was to ensure that the member experience was improved. And that really is one of the core elements, I think, of access and patient satisfaction, ability to do things that you don't need to necessarily go into the office or into the emergency room for. Cleveland Clinic was actually one of our very early adopters into our Live Health Online platform back in 2016. And we've continued to build on that. From that, we went to psychiatry online, and we went to lactation support consultants for new moms. So as I think about all of that, we've been investing very heavily in our digital tools and digital health and patient monitoring. This was obviously a dramatic acceleration of usage. When first the pandemic first hit and we realized that many of the physical offices were going to be closing, we were concerned deeply about our patients' access to healthcare, and we were able to quickly put 2,000 new physicians, credential them, put them online, be able to have access fairly quickly. But we knew that the demand was huge. And as everyone saw, we saw a surge. It has leveled out, but I think fundamentally that the access and satisfaction levels that people have been really positive. Outside of just our Life Health Online program, we're also helping to incent our care providers to enable their offices. We think it's a valuable part of value-based care. It's an element that we can combine with that. And we're trying to help our care providers who didn't have this before have the capability long after the pandemic so that they can build it into their workflow and their work processes. So overall, I mean, I think our preparedness, we were able to move quickly. In the short term, there were longer waits than we would have liked, but I think we've built this infrastructure and platform across the industry that will help us significantly, particularly in behavioral health, where we're still seeing very high usage. And because of the historic access issues in that space, that's a real big opportunity for the long term for patients. So.
It's so nice to hear how much work has been put into it, and I've been really impressed by Anthem's ability to launch a suite of digital tools, and they provide an in-depth and trusted and aggregated information for multiple stakeholders. You just mentioned you're not just helping patients, you're also helping providers to create a data-driven decisions, in particular during COVID-19 crisis. So now the question is, how are these tools, if at all, helping public health officials and business leaders as they plan for the reopening and return to work? We briefly spoke right ahead of this conversation about a return to work in our organizations and how we are guiding our organizations in that really crucial decision for various businesses. Can you speak a little bit about that?
Yeah, I think you've hit on a really important aspect. One of the things that we have been working very hard on, in addition to our digital tools, is taking the massive amount of information that we have across our clinical platforms, our predictive analytics using AI. And as a result of the platform we built a platform over the last few years called Sydney Health, which really houses a suite of our digital applications. We built two applications, one for public health officials, C19 Explorer, and we built another one for employers, C19 Navigator. And the goal of both of those was to aggregate data first on the C19 Explorer part for our health officials to track and trace and identify where potential C19 COVID outbreaks would happen, to look at testing capacity and also look at capacity for healthcare facilities. So that's an application we've been sharing with our states and make it available widely to anyone who wants to use it. And we think, again, for predictive analytics, it's very important. Employers, though, just like ourselves, face some of the same issues. And so our C19 Navigator platform helps employers identify what's happening in their own workforce. It's got an embedded tool that allows them to track testing, biometric screening, all the information about their population so they can make decisions on resources, when to open appropriately. We've also built a biometric passport for employees to track their own symptoms. It's a symptom checker. They can track their own data. It's for them personally on their phone. And again, all of these tools, the goal is really to allow people to have control. Our Sydney Care application has a symptom checker. It also can connect them to telehealth, which we're encouraging people to do. And so I think the view of all of these digital tools is fundamentally to be able to give people access to ready-made information, particularly in times when people are concerned about going into physical facilities. And so they want access, they want reliable information, both at the public health sector around testing and trending and what we're seeing. We've been able to apply artificial intelligence, and our data scientists have been working on this program. And we haven't done it alone. We've been working with partners across the ecosystem of healthcare. And again, I think it's a great test to the system and our ability to come together quickly and be able to solve what I'll call public health crisis and public health problems. So.
Yeah. It's interesting when we speak about everything that we have done that was prompted by COVID and very much accelerated by the onset of pandemic. The logical question would be, okay, that every pandemic comes and goes, but how do we see all this knowledge and competences then being retained after the pandemic is behind us? What do you think? How many of these applications will we be using in the future for the conditions that are not related to the current outbreak?
Yeah, so again, I think that's a really important question. What we saw with the pandemic was an acceleration of usage. We have seen some of that usage return, not to baselines, it's still above baseline. So I do think that as consumers and care providers have gotten more comfortable with using the technology, it becomes more embedded in the workflows of their practices. And I personally have used telehealth along with my family several times and have found it to be really useful. Our satisfaction rates are up there. So I think as a company, I know us along with our care providers, we're trying to build it into the workflow, into the value-based payment arrangement. We're trying to ensure that we use everything available to us. Historically, we would predict based on healthcare economics. Now we can predict based on AI and patterns of behavior and information and data. So my sense is that this is a launch pad for us, that yes, we may see some of that utilization go down, but I actually think we've entered a new era where analytics, a digital first mindset, which we have been very focused on, really changes how care practitioners work with health providers such as us. And this treasure trove of data that we have allows us to inform and predict where things are going to happen. So for example, in the helping public health officials identify where potential outbreaks may be or trends and patterns, helping us identify individual members. One of the areas where we used our data was to understand where members were at risk. Our concern was on members, particularly our Medicare Advantage programs, who had some of the most chronic high-risk conditions, that they weren't getting enough access to care and weren't necessarily using telehealth. So we ran a number of analytics to understand who they were and actually worked with your team at the Cleveland Clinic in Ohio to reach out to those patients with our embedded care managers. And so I think those are examples where both patients become more comfortable and care providers, I think, trust it more as well. And we as payers can play an integrator role in ensuring that it's embedded in our products, it's embedded in our value-based payments. So I'm very encouraged that we will see additional digital health, including monitoring and telehealth and uses of AI to improve our practices and improve, quite frankly, patient outcomes and satisfaction.
Yeah, I couldn't agree more. It's an interesting phenomenon that occurred during this pandemic, is this revelation that a pandemic is not only brought an infectious disease to millions of people around the world, but it's really highlighted a somewhat of a hidden pandemic that has been in existence for a really, really long time. And that is the pandemic of, if we may use that term, of behavioral health and behavioral health issues. Mental health has been now put in the focus of our attention as providers, as payers. And I know that you have been using technology and everything that you've spoken about so far to help our patients with behavioral health and issues. So how has your team adopted to help this very vulnerable population?
Yeah, the behavioral health population is an area before the pandemic that I think many areas struggle with access. And there was patient stigma associated with it as well. So trying to get individuals in to see behavioral health practitioners wasn't always easy. So one of the areas that we have seen an incredible increase, 56 times pre-COVID levels, using telebehavioral health. Our Beacon, I'm really proud of our Beacon team who mobilized very quickly. And by the way, most of our behavioral health providers were not connected originally. We had less than single-digit penetration in terms of using telebehavioral health. So that area has gone up dramatically. And while physical behavioral health or physical health telemedicine has come down, still above pre-COVID levels, but it has come down from the very highs we saw in the beginning of the summer. Behavioral health has stayed very constant, and we see very strong patient satisfaction rates. We think it's a great way to get access. We have put some new tools into our Sydney Care app. One is called PsychHub. PsychHub is very specific. It was built by leading national behavioral health specialists around the country. And again, it's to deal with the stress associated with the COVID-19 pandemic, loss of jobs, everything that we know is happening because of social isolation now because of this pandemic. But we've been working really hard because we think that behavioral health clearly is one of the significantly big opportunities to improve patient care, to help our care providers, I think, be much more integrated. Again, building it into the way, we're trying to incent for outcomes, and using behavioral telehealth is one of those areas. So we've been using best practices, sharing webinars with our practitioners, again, because they had not used as much telebehavioral health, but I think it's an area, clearly we're going to see some real dividends and some great outcomes. And I do think the usage will remain quite high, even post-pandemic, for the longer term.
And a key of the success during this pandemic has actually been a collaborative effort between payers and providers. And now with COVID-19 disrupting a lot of our operations and workflows, how have you ensured that the communication lines remained open and become even clearer during these challenging times?
Yeah, it's one of the areas that we really had to rethink and think very differently about how we communicated with care providers. Oftentimes we would do, as you know, meetings and joint meetings together. And as we were mobilizing quickly, as care providers were shutting down their offices, obviously dealing with the financial issues around the pandemic, we had to mobilize very quickly to change the way we operate. So we took a hard look at all of our practices, wanted to ensure that we could keep our care providers sustainable. But also we recognize, and I think one of the benefits truthfully about this is that we are working much more closely together, both at our local level and at our national level. On the national level, we joined forces and helped co-sponsor the X Prize to bring together a number of groups to find a rapid response, very cheap rapid response to testing for COVID. We've done a number of other things in terms of other partnerships with local care providers. I know that another great example is we accelerated the work that we began a few years ago, even with the Cleveland Clinic, where our embedded care managers, along with your team, have been working together to outreach to our most vulnerable members. And as I was thinking about this and sharing sort of the work we've done with our team, they shared with me a story which I think sort of describes really well, like when we are at our best, care providers and payers, how we work together. So as you know, we've embedded a care manager with your team to help support our 2,400 MA members. When the pandemic first hit, we did, as I mentioned, we had looked at all of our high-risk members and tried to identify them. A call came in, one of our 83-year-old members serviced by the Cleveland Clinic from his case record, knew he had diabetes, he had congestive heart failure, he had a number of comorbid conditions. We called into our case manager and said he was having severe pain. As our case manager was talking to him, he disclosed that he'd recently had a stroke and was having severe pain in his leg and his calf. As part of that, he needed to hang up the phone and say, I really can't continue talking. I'm in so much pain. So he asked us to call his wife, and we did call his wife, who was actually at work. She shared that she was deeply concerned. He had been experiencing pain over the last few days, but was afraid to come in. She didn't want to take him to the hospital. She didn't want to take him to the ER. She didn't know how to use telemedicine. And we immediately contacted your team, your rapid escalation team, who was able to intervene and help this patient. So I think those are, to me, good examples of better collaboration, that the walls are coming down. We've got better information. We're using healthcare analytics to identify patients ahead of time and working more collaboratively. And then we're also using the tools available with us, whether it's telemedicine or not. So I think, or telemedicine or some of the other digitally enabled remote monitoring, all those kinds of things. So to me, that's where the truth lies in kind of the investments we're making, is our ability to impact patients right now and for the future, and allow them to have some of this care in their home. So even after the pandemic, where they're most comfortable, and support them in wraparound services and work cooperatively, I think, with our care providers in a way, in a value-based arrangement, where we're both incented to do the right thing. And so I think that's a great example. The other one that I would share is just the public-private partnership that many of us have joined with, The Fight Is In Us, where we're looking really to find convalescent plasma as a potential cure for those or treatment for those individuals who have active infections. So I'm seeing some really positive things, and I'm certainly seeing them in the digital health space, where we're collaborating across multiple venues. But I'm really pleased with what's broken down some of the historic walls with care providers in particular, so we can accelerate patient care.
It's interesting when we hear conversations like this, what immediately comes to mind is we oftentimes speak about technology. I mean, the topic of this conversation is telehealth, but technology in isolation is not a solution for all the issues and all the needs of our patients. And we also have a responsibility to create a different team dynamic and hire a different type of people in our organizations in order to be able to leverage the best that technology can bring. For example, the coordinator, the care coordinator that you embedded into Cleveland Clinic teams is a person who actually brings the potential of the technology to its maximum. So I'm just curious, when you take a look at your workforce, at your employees and Anthem, and you think about the future of Anthem and where you're heading, what type of talent are you now seeking? What has changed over the last several years?
Yeah, that's a great question. And we often talk about a digital first environment. And that doesn't mean necessarily that we aren't going to have many of the core functions we have. But what we're really looking for is individuals who can connect the technology, the AI, to really human-based, human-centered design type applications. So I think, to me, it's a combination. We're really looking at how do we eliminate handoffs. I mean, healthcare is incredibly complex. We work in a matrix organization, in our organization, and then when we work with organizations like the Cleveland Clinic, you're also quite complex. So to me, the opportunity to take large realms of data to identify where we can make the greatest impact and then eliminate things that have no value. So, the pre-authorization, eliminating some of the administrative burdens when we know that we have practitioners who follow evidence-based guidelines and are based on value-based care. So those kind of things go away. So we are, in terms of our workforce, we've built up a very robust and I think experienced digital team that came from outside the industry, but are very passionate. We've combined them with our clinicians and our front-facing associates who are also very passionate. And we've sort of doubled down, not just on digital first, but on community health. And as part of this pandemic, one of the areas that we're very passionate about, Blue Cross Blue Shield plans grew up in the local community. 84 years ago, we were founded deeply in our communities, and our goal is to make a difference in those communities. So we've seen the data on health inequities and racial disparity as COVID has laid that bare. And we think we have an incredible opportunity using these tools, this data, and this embedded approach to really change healthcare. And so I'm personally passionate and excited about the platform and potential we have. Simply right now is getting people vaccinated, as we spoke about a few weeks ago, in our local community, so that the combined impact of COVID and the flu doesn't doubly hit these communities hard. We look at the infant mortality and morbidity rates for Black moms. We know we can do better. We've seen improvement. So I think these tools, this data, this information gives us an ability to drill down into our communities and work with care providers, both to educate practice patterns and how they treat these populations, but also to improve the overall care. So I think you asked a broader question around our workforce, but I think we're looking to combine people who understand the power of data and tools with those who can deliver this incredible experience at the care provider patient level. And so I think it's a little different and think holistically end to end.
Well, Gail, thank you so very much for sharing the vision for the future of healthcare through collaborations between the payers and the providers. We truly appreciate your insights. Thank you very much for joining us today.
Thank you. It's a pleasure joining you. Appreciate that very much.
Thank you.